when I was pre-med in college, and I came home one summer and I was working for a small town doctor up in Connecticut, real small. I mean, it was fabulous. And I was drawing blood, doing EKGs, things like that. And he was actually the one that kind of helped me think about going into the medical profession. You know, basic primary care things, hypertension, diabetes, thyroid, cholesterol. My background, I used to work in an intensive care unit, and then I worked with an oncologist, so I guess I'm really trying to help prevent cancer. So I'm kind of making sure, you know, women are up to date on mammograms, people get their colonoscopies, and I also work a lot with women with anxiety, fatigue, just coping with life type things. But yeah, so it's kind of a nice mix. You can get a patient in very quickly to be seen, or you can even just run down the hall or up the stairs if you want to run it by somebody. And that's great. And then just with the electronic medical records, always being able to get into the specialist chart, you know, into the chart and see what they were thinking so you can explain it to the patient, sometimes in a different way. Since they've known you for a longer time in primary care, they look to you to kind of say, could you explain that to me again? Because I didn't really understand what they said, and you can read the specialist note and just go from there. But the best thing is really just grabbing somebody when you need a question answered, and that's great. The weather is fantastic. The beaches have been good, and the people. It's just the southern hospitality. I've enjoyed it. It's different because I grew up in the Northeast, but I've enjoyed living down south tremendously.